Scientists have identified about 200 viruses, and there may be up to 700,000 more lurking in nature.
We're one of the few countries in Central Asia where the government fully covers the cost of vaccinations.
A single virus can evolve into dozens of strains, each one different, each one dangerous.
We've detected hazardous airborne chemicals, phenol, acetone.
So how are Kazakhstan's epidemiologists staying ahead of the threat? Compared to traditional methods, which take 3 days to a week for results, this device gives us accurate data in just 3 hours. Every day we leave our homes, unaware of the invisible threats drifting in the air. One contact, one touch, one breath is all it takes for a virus to find a new host. There is no definitive number for how many viruses can harm humans, or how many strains they might mutate into. That's the nature of viruses. They evolve, adapt, and jump from animals to people.
We detect dangerous airborne compounds like phenol, acetone, and formaldehyde. These are highly toxic chemicals ranked among the most hazardous, capable of damaging the central nervous system and other vital organs.
So Sharipova knows what safety looks like, down to the molecular level. Under her guidance, the center's labs test food, air, water and more, tracking hidden threats before they can harm human health. Open in 2023, the center plays a vital role in protecting public health in Kazakhstan. It was purpose-built to meet the high standards of sanitary and epidemiological diagnostics.
This is the first time a facility was developed entirely as a dedicated center for sanitary and epidemiological testing, from land allocation to commissioning as a full-scale lab. The building is freestanding and zoned with precision. Clean and contaminated areas are completely separated. HEPA filtration systems prevent any environmental exposure and safeguard personnel. Every design element ensures safe, controlled movement and containment throughout the facility.
This is Central Asia's first biosafety reference laboratory, with test results officially recognized in 112 countries around the world. Here, scientists ran advanced analysis of environmental and food samples, testing for bacteria, genetic mutations, parasites, chemical toxins, and radiation.
We analyze everything from the tiniest objects to aerospace materials. Our focus is the environment: air, water, soil, anything that can impact human health. We also test raw ingredients, processed foods, and consumer goods, wherever there is a potential threat to public health of future generations. That's where our work begins. Just recently, we found dangerous levels of arsenic, lead, and mercury in fish samples. In poultry, we detected salmonella, the bacteria responsible for salmonellosis, which can trigger widespread food poisoning.
У нас находятся пробы, это растительные масла, крупы, бобовые.
These are some of the samples we're testing: vegetable oils, grains, legumes. We place them into a special chamber inside an automated extraction system. This process allows us to isolate harmful compounds like dioxins, dibenzofuran, and PCBs for further analysis.
интересующие нам компоненты, такие как диоксины, дибензофураны и полихлорированные бифенилы.
Dioxins, dibenzofurans and PCBs, polychlorinated biphenyl, are among the most persistent and dangerous pollutants on Earth. In 2001, they were added to the list of the 12 most toxic substances known to humanity. PCBs are often referred to as chemical aids. They gradually destroy the immune system, suppressing antibodies, weakening T cells, and stripping the body of its natural defenses. They accumulate in fatty tissue and stay there for years, silently damaging the endocrine, reproductive, and nervous systems.
Данный прибор позволяет одномоментно выполнить 3 этапа. Это экстракция, очистка и выпаривание.
This machine performs 3 steps in one go: extraction, purification, and evaporation. Traditional methods can take 3 days to a full week. This system gives us results in just 3 hours. Here, at the evaporation stage, we obtain the final extract. It's collected in a specialized microvial, sealed with a cap and placed into the analyzer for further testing.
Специальные микровиали. Данное микровиалу мы закрываем крышечкой и переносим уже на сам прибор для последующего анализа.
State-of-the-art equipment and express diagnostics make it possible to deliver fast, reliable results when timing is everything.
Когда мы говорим о проведении предупредительных мероприятий, противоэпидемических мероприятий.
When it comes to outbreak prevention, many factors matter, but accuracy is the starting point.
Доверенность лабораторных исследований. Когда мы работаем.
High-tech equipment, modern labs, and trained professionals ensure we get reliable data. Then comes the second key factor, time. Let's say 3 or more people get sick after eating at the same restaurant or from food served in a school or kindergarten. The faster we trace the source and remove the product from circulation, the faster we stop the spread. Fewer people get sick, the source is isolated, and containment measures are rolled out without delay.
Эпидемические мероприятия, выявлен продукт, который является источником, заражения людей, тем быстрее будет ликвидирована вспышка, меньше людей пострадает, продукт будет снят с реализации, соответственно, все мероприятия будут проведены вовремя.
Measles, diphtheria, polio, tuberculosis. These diseases once claimed millions of lives. Today we call them vaccine-preventable because science gave us a powerful weapon: immunization. And thanks to routine vaccination, outbreaks no longer become full-blown epidemics.
Kazakhstan is one of the few countries in Central Asia where vaccinations are fully covered by the national budget.
Still, even in the age of science, some people reject vaccines. And that's why diseases we thought were behind us are returning.
Примерно с 23-го года в Казахстане, как и во всем мире, отмечается рост заболеваемости.
Since 2023, we've seen a rise in measles and whooping cough here in Kazakhstan, just like in many other countries. These are vaccine-preventable illnesses, but they are spreading because more and more people are skipping vaccinations. 98% of those infected were unvaccinated. Some had medical exemptions, but most simply refused the shot. Both infections are airborne. They spread through coughing and sneezing, which means they cross borders without needing a passport.
Основная масса – это по причине отказа. Эти обе инфекции, они передаются воздушно-капельным путем, и, как вы понимаете, то есть при кашле, при чихании, и поэтому границ для этих заболеваний нету.
One unvaccinated child can trigger a chain of infections. Epidemiologists are clear. Vaccination isn't just a personal choice, it's a collective protection. When that protection breaks down, everyone is at risk. In 2019, the world was hit by an unknown threat, COVID-19. There was no vaccine, no proven protocols, no ready-made solutions. Everything had to be built from scratch. Epidemiologists stepped up, tracing outbreaks, designing early isolation strategies, and helping develop testing and vaccines.
Были приняты меры по изменению обучения в сфере санэпидслужбы, восстановлен факультет санэпидслужбы, который...
We had to completely rethink how we train public health specialists. The Faculty of Sanitary Epidemiological Services, which had been restructured many times, was fully restored.
Все восстановлено, снова уделяется особое внимание качеству подготовки кадров.
Training programs, once drastically cut, were rebuilt with a strong focus on quality education.
Медицинских работников всех уровней, начиная с самого более...
We also raising the knowledge level of healthcare workers at all tiers, starting with those in direct contact with the public. We upgraded labs, introduced rapid testing methods, and digitized systems for faster results.
Более по цифровизации, где получение результатов лабораторных исследований.
With support from international partners, we launched 3- and 9-month courses for epidemiologists and lab technicians, not just from our agency, but across sectors. Some diseases affect both people and animals, which is why veterinarians now train alongside public health professionals. We've also embedded infectious disease prevention, including immunization, into medical education programs across all specialties.
Программы не только эпидемиологов, но и медицинских работников, подготовки медработников всех профилей.
Every day, experts share critical data, from hazardous substances to outbreak maps and transmission routes. Kazakhstan's Center for Sanitary and Epidemiological Expertise, for example, provides access to ToxBase, the world's leading toxicology database. It includes more than 17,000 chemicals, explains how poisons work, and offers treatment protocols and antidote guidance. Doctors rely on it daily to recognize toxins, make fast, accurate diagnosis, and save lives.
Проект реализовывался между 5 стран Центральной Азии. На сегодняшний день в рамках реализации проекта такие токсикоинформационные центры...
This project was launched across 5 Central Asian countries. So far, only 2 toxicology information centers have been established in Pakistan and Kazakhstan. We work closely with toxicologists. Earlier this year, we held 2 conferences with the World Health Organization, oncologists and toxicologists, focused on how chemicals affect human health. Our team is also helping set up Kazakhstan's National Toxicology Information Center and building a specialized database called Kazakh, designed with our country's specific geographic and environmental context in mind.
С учетом национальных особенностей, это географических особенностей Казахстана.
Потом мы взаимодействуем, кроме Всемирной организации, взаимодействуем с ЮНИСЕФ, взаимодействуем с CDC, совместно с ними проводим...
Beyond our partnership with WHO, we also work with UNICEF and the CDC. Together, we run training programs, workshops, and professional exchanges. We also engage with international medical platforms, sharing knowledge with countries near and far. These exchanges help us learn from others and offer our own expertise, especially with countries that share similar healthcare models and ethnic background.
Схожесть с Казахстаном по системе здравоохранения, по этническим каким-то направлениям. Мы здесь получаем взаимный опыт.
So far, science has identified around 200 viruses dangerous to humans, but nature is hiding hundreds of thousands more, capable of mutating and triggering the next pandemic. That's why the role of epidemiologists is so crucial. They are the ones watching for threats we don't even see coming.